But there's one decision that everybody has to make right now. And some of you have already made it and are done with this decision. And that decision is your renewal date. Humana has given us projected impacts for groups that renew January through May. So they've already had their renewal this year. They kind of give us a ballpark. And I wanted to go through that with you. We kind of, this is several pages long, but these are groups with less than 25 people covered on their health insurance plan right now. Figured that covered the majority of people in the room. And I took out their names and just put their industry in here. And what Humana's done is said, if you renew in December, this is what your projected increase is. If you renew on January 1st or after with modified community rating as a small employer, there's what your rate impact is going to be. Because of the small print, let me kind of talk to you about some of the highlights. Why this decision is important is because it can mean as much as a 40% savings for those companies at the top to choose a January 1st renewal date over where they're at now. But it could also mean if I renew January 1st instead of December, that I'm paying 90% more than what I am now if I have the incorrect choice in my renewal date. So one, you should be with your agent analyzing is what's the right decision for me as a company. Some of you have already changed that or have already talked about that. Essentially, depending on the carrier, most carriers say by September you have to have that decision made. But with Humana, they are actually saying by the end of July, if you're with Humana as your group insurance carrier, you have to know by the end of July exactly what your renewal is going to be. So it's coming up quickly. We still have time to analyze and decide what you're going to do, but it could be as much, for most companies, it's 30+% swing in the rates. But let me just talk to you about how do I know, give you some hints. So companies here that will see the largest increase, more than a 20% increase, generally speaking, are younger, healthier, and better looking. No, I'm just kidding. So generally speaking, because of modified community rating, they get the brunt of the increase. Most of them are receiving discounts because they are a healthier group. Groups in the middle that are, you can see there's a group of 5 or 10 here that are really see no difference in their rates. I've seen primarily what I found is that they're younger female groups. You know, between average age of between 35 and 45, mostly female. Have almost no rate increase. They're not old groups or young groups. They're just kind of right there in the middle. They don't really see much impact. The groups at the top, we have about 15% of our clients that will see pretty significant discounts if we just move them to January 1st renewal dates. Those groups are current ones that are small, really they're rated up because of health conditions, or their average age is over 50. So generally speaking, they'll see their rates go down. So now it's very general. There's been some anomalies across the board, but there's also the potential implications of being forced to a richer plan than what you have now too. So why there's a spread and they don't know exactly is because in December renewal dates you can still qualify for wellness discounts. You can still be underwritten. There's still some flexibility in how they rate. So if you haven't changed your renewal date, please do that quickly.